If you're new to Medicare, you definitely know the struggle is real. You might be confused about how it all works, like why are there so many parts and which parts do I need? Well, don't worry, my name's Chris Scabora, my company is Scabora Life and Wealth Group, and today we're going to take the confusing parts of Medicare and simplify them for you. First, we're going to talk about Medicare Parts A and B. Now, these parts together are what we call traditional Medicare or original Medicare, because these were the two parts of Medicare that have been around since it has originated. Medicare Part A is your hospital insurance, so think about buildings. So this is the part of Medicare that helps cover inpatient hospital stays, skilled nursing facilities, as well as hospice and home health care. Part A is going to be premium free for most people that have been living and working in the United States for 10 years or 40 quarters, or for those who have a spouse that meets the criteria. It's important to know that Part A does not cover long-term care. So nursing home care that is considered custodial care is not covered by Medicare Part A. Now, the second part of original Medicare is Medicare Part B. Medicare Part B is considered your medical or doctor coverage. There are many services that are covered by Medicare Part B, including doctor's office visits, physician fees, diagnostic testing, ambulance services, preventative services, durable medical equipment, and even many non-self-administrated medications are going to be covered by Medicare Part B. Medicare Part B is not premium free, which surprises many people when they are turning 65 and enrolling into Medicare. It's important to know that if you do not have any additional medical coverage, you may be responsible for deductibles, co-pays, co-insurance, and several other things. These amounts can change each year, so it's very important to review your coverage every year with your broker. Now, let's dive into Medicare Part C, which is also known as Medicare Advantage. This is an optional part of Medicare that you may or may not be interested in enrolling in. Medicare Advantage plans are managed care plans, and they are offered by private insurance companies that contract with Medicare. These plans offer an alternative way to receive your original Medicare benefits. So instead of having traditional Medicare Parts A and B through the government, you now have a managed care plan like an HMO or a PPO through a private insurance company. In order to enroll in a Medicare Advantage plan, you have to be enrolled in Medicare Part A and B, and you have to continue to pay your Medicare Part B premium. Medicare Advantage plans will cover the same services that traditional Medicare Parts A and B cover, but they're allowed to set their own cost share requirements, their own co-pays and co-insurance amounts that you're responsible for. The rule for Medicare Advantage plans is that they must be at least as good as original Medicare. Therefore, some of these plans will have additional benefits not found in Parts A and Part B. Medicare Advantage plans generally work with a network of doctors, so there will be a list of doctors providing